in addition to the advent of bispecific antibodies and T-cell engagers in relapsed refractory multiple myeloma, we've seen at this ASH 2022 annual meeting in New Orleans some very exciting data about a novel agent, namely Modakafusp. We need to learn how to pronounce it, which is a first-in-class innate immunity engager. So it's a totally different new family of immune therapies relying on the immune systems. And to make a long story short, it's about delivering interferon alpha to those CD38 expressing cells. And this is very exciting because historically we know that in the 90s and early 2000s, interferon alpha was used widely and was shown to be promising as maintenance treatment in multiple myeloma. And here, what's really interesting with this new agent, let's call it MODA, because it's easier to pronounce, is that in highly relapsed refractory patients, including those patients who are resistant to anti-CD38 monoclonal antibodies, you can achieve an overall response rate of more than 40%, I think 43% roughly in the phase 1 trial, and with almost 6 months of median PFS. And what's also interesting is that you don't have significant or serious side effects, especially when it comes to infections. So the safety and tolerance profile is excellent. So this is really very promising. Obviously, the next step is about beside adjustment of the dosage, finding of the right schedule, etc., it's about also finding the right combinations. But I think the most exciting part of the story is that on one hand, we have the bispecific antibodies which are T-cell engagers. This is the adaptive immunity. And on the other hand, we have the innate immunity being targeted. And I believe this is really at the heart of the immune therapy, which is likely probably what would allow us in the future to cure or to extend the survival of many patients. This is why I'm very excited about this new class of agents in multiple myeloma, which has a very promising efficacy profile, but also safety profile, which would allow us likely to give it to elderly, but also maybe frail patients with comorbidities. And this is something which may not be easily feasible in those patients with T-cell engagers.